Yeah, hi. Um, Good evening, friends. So, we are live on our YouTube. I hope you all had a fruitful session with our test and discussion of dental materials. Well, we've tried to incorporate, it was you can say, a comprehensive short test of about 50 questions, and we had tried to incorporate and cover maximum number of concepts that come, graphs, image based questions, based on image based questions, important values, ADA specifications, and so on and so forth. Guys, it's wonderful to know that you are. Yeah, good evening, everyone. Um, Please guide BDS first year, sir. All right, guys. That is, of course, that is something that we keep talking about. You have to start preparing for your exams right from day one. Then, very interesting. Rajni Mishra, sir, please mention the difference in order of solubility of dental cements in oral cavity and in water. See, guys, as far as the order of solubility as per the table given in Phillips is concerned, all right, it specifically mentions the order of solubility in water, and that is a great source of confusion. Number one, as far as the conventional cements are concerned, conventional, not the modern day. That means, yeah, yeah. Just a second, guys. Um, all right. Yeah, I hope. Yeah. So as far as the conventional cements are concerned, friends, the order of solubility in water is a great source of confusion because when we talk of water and it's the solubility of the cements in water, then amongst the conventional, that is GIC, zinc phosphate, zinc oxide eugenol, and zinc polycarboxylate. GIC has got maximum solubility. Then we have zinc phosphate, and then we have zinc oxide eugenol and zinc polycarboxylate. But when we talk of the oral cavity, guys, when we talk of the oral cavity, then out of these four, actually GIC has got the least solubility. All right. And then we have zinc phosphate, and then we have zinc polycarboxylate, and then we have zinc oxide eugenol, right? That's one thing, friends. The other important thing here is that the least solubility in both the situations, that is water as well as oral cavity, least soluble is resin cement. So in that sense, resin cement is great. All right. In that sense, so I hope this is clear. Um, Specifically in Phillips, the table gives you only the order of solubility in water, and that is GIC's maximum, then zinc phosphate, and then zinc oxide, eugenol, and polycarboxylate. But in the oral cavity, this concept is given specifically in Craig only, right? And many of us don't read Craig. So GIC has actually got the least solubility amongst the conventional cements, then zinc phosphate. So in that sense, zinc phosphate is great. Then we have zinc polycarboxylate and zinc oxide eugenol. Very, you know, um, very understandably, zinc oxide eugenol, of course, is very much soluble in the oral cavity, right? Um, then, guys, one some of you have been asking us questions regarding. Yeah, just a second. Where are we here? Yeah, some of you have been asking us some questions regarding the concepts of various types of heat treatments. All right. So I'll just tell this to you conceptually so that you remember this well. Heat treatments. I think we have some lag here. Yeah. Okay. So when we talk of heat treatments, we have one is uh, homogenization heat treatment, right? The other is annealing or softening heat treatment, right, guys? Now, in homogenization heat treatment, we have to understand that, why do we require homogenization heat treatment? Now, imagine we have this liquid alloy which is completely molten, and we have to convert this into a solid, right? So we lower the temperature, isn't it? That's where we learn about the time temperature cooling curve. So as you go ahead in time on the x-axis, and you have the temperature on the y-axis, so as I cool this, then the liquid is going to convert into the solid state. Now, if this happens very rapidly, right? This happens very rapidly. What happens is that you don't have a uniform, homogeneous structure in the alloy that is formed. When you talk of, say, an alloy which is being converted from the liquid state to the solid state, right? And this classically happens in which when you get a dendritic microstructure. Now, this is again another very important thing that some of you have also asked us. Dendritic versus, equiaxed grain structure. So I'm going to combine both the concepts of heat treatment with the structure of dendritic and equiaxed grain structure. We'll understand this together, right? So that we develop this concept. Now, if I do very rapid cooling, right, then what happens is I get non-uniform, in the different layers of the solid that is being that is just solidified, right? The different layers are going to have different compositions, right? And that structure will become more prone to fractures and corrosion and basically diminished physical and mechanical properties, right? So what we need to do is, in order to get a more uniform structural composition across the solid cast ingot of the alloy that we have got after cooling, you need to heat the alloy, right, at a very high temperature, but at the same time ensure that the temperature is such so that again re-liquefaction does not take place, right? So you would keep the temperature just below the solidus temperature, right? You have the liquidus temperature, right, above which the entire alloy is liquid. Then you have solidus and liquidus, in between which you have partially, isn't this is the time temperature cooling curve of the of an alloy, in which this upper curve represents the liquidus, this lower curve represents the solidus, right? So you want to heat the alloy at a temperature which is high enough but just below the solidus temperature, all right, so that again reliquefaction does not take place. So this causes rapid, diffusion, equal diffusion of all the different constituents of the solidified alloy in the set, cast cooled structure, to give you a homogeneous, more of a homogeneous structure. So in homogenization heat treatment, the MCQ that we get is, what is the temperature? High temperature just below the solidus temperature, right? You have to heat it just below the solidus temperature. Then the next type of heat treatment is annealing or softening heat treatment. Now, this is done in which situation? This is done in which situation, guys? This is done in the case of wrought alloys. What are wrought alloys? Wrought alloys are those structures which are deformed from the cast ingot that you have. For instance, this is the structure, this is the brick of cast metal that is solidified, right? Cast alloy that is solidified. Now I want to convert it into a clasp. I want to convert it into an orthodontic appliance, orthodontic wire. So obviously I'm going to deform it. When I deform it, what happens? The strength increases when I deform. That is, I extend it by by giving it a tensile stress, right? So I convert it into a elongated wire to be used as an orthodontic appliance, right, guys? So ultimately, what happens when I deform the structure? The strength increases, hardness increases, but since I've already consumed the ductility of the material, the ductility decreases because I've already, elongated it. Right? This is an example that I'm taking under tensile strength. Of course, I can deform it under compression also. That would be under compressive strength. Right, guys? Now, when I want my properties to revert back, when I want to regain my softness, when I want to regain my ductility, when I want to regain my ductility and get a and want to get the metal or the alloy in its starting form, then what do? I do a softening or a annealing heat treatment, right? And the three stages of a annealing heat treatment are recovery, then recrystallization, and then we have grain growth. Right, guys? Recovery is the stage where the residual stresses are relieved. That's one. Recrystallization is the actual stage where the opposite of what has happened when I've converted into a wrought alloy, when I've deformed it, actually starts to happen. So in recrystallization, the strength decreases, hardness decreases, but the ductility increases, guys. You understand? So basically, when I'm recrystallizing, when I'm doing annealing heat treatment, it is during the second stage of the annealing heat treatment that I'm actually able to reclaim or regain the lost properties that I had lost during deformation. Right, guys? This brings me to the next question that you guys have asked. Some of you have asked the difference between flexural strength versus other strengths, like other forces like tensile, compressive, shear. Please remember, guys, tensile force or tensile strength is in the direction of the long axis of a material. Compressive is, compressing the material, right? So you have a cylinder, you're compressing it, right, guys? And shear is parallel to the surface of the material, right? So it's like, in olden days when you used to, sharpen our pencils with a blade, right? Instead of using a sharpener, when you used to sharpen our pencils with a blade, right, guys? That was a shear force that we would apply. Now, whenever you're trying to flex a material, that is bend a material, flexural stress is always a combination of these three. So in other words, when you're applying flexural force, right, guys, in flexural force there will always be a combination of all this happening. How? So if I'm trying to say bend this pencil, all right, I have this pencil or I have this beam of rod, right? I'm trying to flex this. On the outer curvature, there would be tensile stress. The inner curvature, there would be compression. And of course, some of shear forces which will be acting along the some vector of shear stresses which will be acting parallel to the surface. Right, guys? So flexural force represents combination of tensile, compressive, and shear. Right, guys? In relation to this only, I had given a very put in a very interesting question regarding where we discuss the properties of brittleness, ultimate strength, and resilience. So always remember that whenever you have a stress strain curve, whether we are talking of tensile force, whether we are talking of compressive force, whether we are talking of shear stresses or shear force, or in general flexural stress, right? This stress can be anything. The fact remains that the graph would be either this, which is a perfectly brittle material. This material is incapable of any kind of plastic deformation because there is no curve beyond the proportional limit. Then there can be a material which is showing a curve like this. This material is definitely capable of lot of plastic deformation. And the third graph can be somewhat like this, in which the plastic deformation is only this much. So this material is capable of, the C material is capable of less plastic deformation, so this is relatively more brittle than B. And A is perfectly brittle, B is the most plastic, right? If I talk of resilience, resilience is the energy stored in the material till the proportional limit. So you can see here that the flatter the curve, right, lesser is the modulus of elasticity, greater is the resilience. Another very important takeaway and a very important all India question that came is that if you have less modulus of elasticity, flatter will be the curve, more will be the elastic range, isn't it, guys? So, for instance, if I have two wires, right, say I'm comparing stainless steel with night. Just imagine. So stainless steel has got more modulus of elasticity. Night eye has got lesser modulus of elasticity, right? Now, if I simply try to understand what is the elastic range, so you can imagine here whatever deformation that has taken place. This is the stress, this is the strain, right? So till the proportional limit for stainless steel, this much of this is the elastic range, or this is the completely recoverable deformation, right? And for nickel titanium, this is the elastic range, right? So you can imagine this is much more. So if this is B and this is A, you can imagine B is much more than A, right? So whenever you have a material of greater resilience, which implies lesser stiffness or modulus of elasticity, the elastic range will be higher for that material. So the MCQ, very important applied MCQ that comes here is that the elastic range of night eye is greater than the elastic range of stainless steel. This brings me to the next very important MCQ, that is out of, now you have a table in Phillips in which night eye is mentioned, stainless steel is mentioned, beta titanium is mentioned, which is nothing but a alloy of titanium and molybdenum, right? And you have Lg alloy, and Lg alloy is what? Cobalt, chromium, nickel alloy, right? And out of these four, Lg alloy or cobalt, chromium, nickel has got the highest modulus of elasticity. Means it has got the least resilience, means it has got the lowest elastic range, right? So please remember, try to correlate and understand basically what the examiner is trying to ask, and always try to, guys, these are times where direct questions don't come very commonly, so you have to understand the diagrams and the graphs that are given in your Phillips. Then another question that some of you asked was regarding yeah, what do we have? Good evening, sir. Okay, truing and dressing, guys. um okay, so truing and dressing. So basically, guys, so one of you has asked, who's this? So please explain truing. Gauri MR. Hi Gauri. Hi Dr. Gauri. So truing and dressing, right guys? So what happens is when you have a burr or a stone, right, and you're using it for a long period of time, so what happens is that, so this is the shape of the burr, right? You have a nice burr that you've purchased from the market, right guys? It has got its abrasive particles. Now once you're removing or using it for finishing and polishing, the composite material or whatever restorative material gets embedded in its in the burr, right, which obviously reduces its efficiency, which increases heat production. So you need to remove it, right? You need to remove those impurities that are coming on the burr, right? So the process of dressing is nothing but rubbing this burr on a relatively on a more harder surface, right? On a harder surface like diamond, like a slab of diamond, right, which would abrade this abrasive. This abrasive is a burr which is made of a relatively softer material than the material that you're going to use to clean this, that is dressing, right? Sometimes what happens is that you need to, because of excessive use, the shape of this burr gets distorted. You want to bring it back to its nice symmetrical shape. Again you need to abrade it. So again you need to rub it or work it against a harder substrate like a diamond slab, right guys? So therefore truing and dressing technically, or the method, correct laboratory method of doing it is the same. It's just that um, specifically, more precisely speaking, dressing is the process where you are cleaning the surface. Truing is the process where you are bringing it back to its original form and shape, right? But obviously when you're truing it, you're obviously simultaneously dressing it also, you cleaning it also, right guys? So for all practical purposes, this is there. Okay, instrument preparing oval canal. Okay, yeah. So oval canal, see, when you're doing oval canal, you basically, you need to, who's this? Dr. Simia. When you're doing oval canal, guys, you need to, yeah. So you need to do what? You need to do circumferential filing, right? So you need to do circumferential filing. S file is good, H file is good. Just let me know. Put in the comment section what is the perspective through which the examiner has asked this question. Both files are great for it. Even our stainless steel K files are wonderful for preparing oval canals. The idea is that you need to contact the maximum surface area of the canal. So normally, when you're using rotary instrumentation, if you're not doing brushing motion on the outstroke, then some of the portions of the oval canal are left uninstrumented, right, guys? Um, what is cristobalite triadiamide fused quartz, sir? Okay, guys, doc cristobalite triadiamide fused quartz. They're all forms of allotropic forms of silica. So whenever you're using, gypsum bonded investment materials, you usually use quartz and different forms of silica like quartz and cristobalite, which are basically refractory material. Why? Because when you're using it as an investment material, see, if you're using gypsum, right, it's great for pouring cast and getting the cast, right? But if you're using it for dewaxing procedure, for wax burnout, you're taking it to a very high temperature of 600, 700 degrees Celsius, gypsum would break down. So you need to have a material which would give the gypsum refractory property. What is refractory property? Make it more resistant to high temperatures so that it doesn't break down. Number one. Second, gypsum at high temperatures has the a property of degrading and contracting. It shrinks. So and if you the main property of an investment material is to compensate for alloy shrinkage, right? So you need to expand it. So quartz and cristobalite, they basically after a certain temperature, when you take it to higher temperatures beyond 200, 300, 400 degrees Celsius, they expand. So they compensate for the shrinkage of gypsum that takes place on increasing the temperatures to the temperatures that are required for the burnout of the wax pattern, right? Um, all right, that's great. Uh, how does changing material like gypsum or phosphate affect the investment, sir? So basically, you cannot. Gypsum bonded investment material, you're compensating for the alloy shrinkage by either using the hygroscopic expansion technique in which you take the maximum temperature to 500 degrees Celsius, or you're using the high heat technique in which you're able to, take it to 700 degrees Celsius. Beyond that, so that's great for noble metal alloys, right? When you have to do your casting in noble metal alloys. What about base metal alloys, in which you have to take the temperatures to higher temperatures, like 1000 degrees Celsius, 900 degrees Celsius? You cannot use gypsum bonded investment material. So in that situation, you use phosphate bonded investment materials, in which you have to take the temperature to a higher temperature of 900 to 1000 degrees Celsius, right, guys? Okay. Devashri, in the question about the disadvantage of characteristics of inlay wax, totally agree with the answer. Okay, but wax is not rigid, tend to distort. Yeah, of course. But yeah, the best option, let me just see the question which you're trying to ask. The disadvantage. Yeah, which of the following characteristics of inlay wax is a major disadvantage? High thermal expansion is the major disadvantage. So what are you trying to ask? But wax is not rigid, soft enough. It can distort. Yeah, absolutely. That is so. So the flow of wax is a disadvantage in that sense. But guys, you need the flow of wax because you want it to flow when you're taking the wax pattern. You want it to flow to all the line angles and point angles and all the minute details of the cavity prep, right, guys? So obviously, um, that is something that is required. It's a necessary evil, right? So the best answer here is thermal expansion only. Sir, please explain other causes of other casting defects. See, porosity. Apart from porosity, the defects that you have is surface roughness or irregularity. You have incomplete casting, wherein you don't have any, the pressure with which the molten alloy is to go into the mold cavity. You're not applying that adequate pressure, so incomplete casting. Then you have distortion. That is another casting defect. What are the causes of distortion? You have a distorted wax pattern. Again, the same concept that Divishri just asked, that so flow and distortion is a big disadvantage of waxes. Yes, it is a big disadvantage of waxes, guys. um, that is why you need to invest the wax pattern as soon as possible. Secondly, when when you've heated the wax pattern, you've made your nice, you've taken a nice impression, done your carving of your class 2 inlay or onlay or whatever you're doing, or your full crown prep. You're making the coping, or you are giving a full metal crown, and you're doing your wax pattern. Then after you've done so, after the wax is cooled, do not apply excessive pressure. Again, if you apply excessive pressure, then you're basically incorporating heat and distortion of the wax pattern. Then after that, when you subject it to further heat, while the gypsum bonded investment is setting around it, it would distort more, right? So basically, you have to handle it very carefully. You don't have to keep on applying excessive forces. You have to invest it immediately as soon as possible. So distortion, surface roughness or irregularity, porosity, incomplete casting, they're all different, things related to the defects. Of course, guys, I mean, in order to have detailed discussion, this is a short session that we are having, right? So in order to have this detailed discussion, guys, you need to become a subscriber of DBMCI, right? We go with detailed videos in which we cover. We do not leave anything untouched. This is like a, what do you call, this is like a more of a short half an hour duration, informal kind of a discussion. Do go ahead with our um, with our subscribing for our complete lectures and complete package. You will get very detailed insight into all these things that I'm talking about. Then what else? What else have you guys asked? Let's just see this. Ha, Mansi. So, coefficient of thermal expansion. When you're talking of porcelain fused to metal, very interesting point you made. When you talk, see, you basically have metal coping and then you have porcelain, right, guys? Now, it is said that the coefficient of thermal expansion of the metal and the porcelain should more or less match with the coefficient of thermal expansion of yeah of metal being slightly higher than that of porcelain. What will that do? Very interesting. So you've taken it to a very high temperature. You fired your porcelain, that is coated or bonded your porcelain over metal, right? Now it is cooling. So when you have a coefficient of thermal expansion which is of metal which is greater than that of porcelain, slightly greater than that of porcelain, its contraction will also be slightly greater than that of porcelain, right? So imagine a situation in which this is the metal, right? And this is the outer structure, the outer covering is that of porcelain. So metal is contracting slightly more than the porcelain. This would keep the porcelain under a slight compressive force, a residual stress, compressive stress will keep the porcelain under a residual or an unresolved compressive stress in which it would tend to kind of stay in a state of compression with that of the metal. This residual compressive stress on porcelain will help in preventing future fracture of the brittle porcelain. Why? Because any tendency of crack propagation on the surface of porcelain would be retarded, would be stopped by the fact that the porcelain is already under residual compressive stress. You understand? It is exactly the same concept of thermal tempering. Thermal tempering is another, you know, way of having, the surface of porcelain to be in a residual state of compressive stress. When you talk of, fracture resistance of, high strength windshield glasses and, the glass panes on your cars, right? So what happens is that while during the manufacture, these glasses, they're again just like porcelain, they are very what do you call they have got very low coefficient of thermal expansion, right? So the moment you manufacture these glasses, you put them in cold water, all right? You put them in cold water. So what happens? The surface kind of contracts very fast. The inner layers of the glass, they take more time to contract because the glasses have got low coefficient of, they've got low thermal conductivity. So the coolness from the surface passing into the interior takes more time. So therefore, the inner structure which keeps on contracting after the outer structure is solidified puts the outer structure under a residual compressive stress. So eventually this is the same thing that is happening when you have a slight difference in the coefficient of thermal expansion of porcelain and metal for PFM, and the other concept wherein you're trying to retain the residual compressive stresses on the outer structure of the glasses on your cars, right? It's the same concept, right, guys? All right. What else do we have? BDS फर्स्ट ईयर में क्या क्या परचेज करना चाहिए सर? Right. So in BDS first year you have anatomy, physio, biochem, right, and DADH, right, friends? So I mean, it's not very clear, Aryan. What exactly are you? Uh, just a sec, guys. Where is my yeah? Yeah. So yeah, Aryan, what exactly are you trying to ask? Whether you want to subscribe for the coaching institute or the textbooks that you have? Always read standard textbooks, Aryan. Dental materials, in our time we used to have it in first year. Now it is in second year. So very important, and cuspal. Anyways, that is something that we can discuss. That we've already taken a lot of videos on. The approach right from first year. And one thing I tell you, the times are very competitive, so you need to really start, straighten your back and start your preparation. Do standard preparation. Do study standard textbooks, right? Um, do start doing MCQs on a leisure basis, right? You enjoy your college, but start doing MCQs on a leisure basis, right? You finish one chapter from college, read your topic from your standard textbook. If you're reading biochem, read Lippincott, read Harper, read good books. Don't take shortcuts, and then do MCQs, right? If that is what you're asking. So that explains that. Sir, cuspal reduction and cuspal capping. Uh, yeah, so basically, see, they increase their basically cusp reduction is what? Whenever you're going for an onlay, right? Or in a direct amalgam restoration, whenever your distance from your central groove to the cusp tip is greater than or equal to two-third, right? You basically ended up undermining the cusp strength. So if you reduce the cusp and cover the opposing cusps, you have to cover the opposing cusp, buccal and palatal, or buccal and lingual, with the same restorative material, whether it's a crown, whether it's an amalgam, whether it's a composite, right? Whether it's a porcelain crown, whether it's a metal crown, whether it's a gold crown, you've ended up splinting the two together. You understand? It's like you have a fracture in your hand and you've taken a stick, wooden stick, and tied the two, the fractured segment and the splint, with a rope. So you're basically preventing any further dislocation, right? So you have undermined cusps. They weaken strength because natural tooth structure has been lost, right, guys? So you need to splint them, and the way of splinting in the oral cavity is giving a cuspal coverage restoration, guys. All right, so that's the way of doing it. So I hope that solves your purpose, and this obviously increases your both your retention and resistance form. So it's like, understand this as a secondary resistance and retention form, isn't it? To simplify, right, guys? Okay, subsurface porosity, Nidish. See, subsurface porosity. See, first of all, one, you have porosity due to solidification defect. The other is porosity due to trapped gases, right, guys? Now, due to trapped gases, you have gas inclusion, pinhole, you have subsurface, and you have back pressure. Subsurface porosity is the porosity which occurs due to simultaneous nucleation of gas bubbles and the solidifying grains of the solid alloy on the mold walls. So basically, the thing is that it's happening. It's basically happening due to rapid inflow of metal, right? So there's turbulence that is created on the mold wall in your investment material, right? So when so it's like waves, angry waves crashing on this on the seashore, and just imagine that you put a wall on it, right? So they create those, when they crash on the wall, they're going to rise up, they're going to create turbulence, air bubbles, and imagine those waves are being solidified. So you basically have, simultaneous, nucleation of the bubbles and the solidifying metal grain, the first metal grains solidify on the mold wall, and this is because of rapid inflow of the metal. So how do you reduce it? You can increase the length of the screw, you can reduce the melt temperature. So basically, whatever methods are there to reduce the rapid inflow of metal into the investment mold is a way of um, reducing the subsurface porosity. A great question that you've asked, guys. All right, Sagar. Procedural ledging, strip perforation, zipping, transportation. Okay, that's simple. Let's just see this, guys. Okay, I hope you can see the screen. Great. So this is my tooth, right? That's my root canal. That's the curvature of the canal. All right. Right, guys? Now, if my file is not pre-curved here, if my file is not pre-curved here, and I just keep, digging on the outer curvature here, right? So I create a platform here, that's a ledge. If I don't stop and if I don't mend my ways, then I end up perforating here, that's a ledge with perforation. So that's one thing, right, guys? What's the next thing that you've asked? Strip perforation. Okay, I'll tell you that. What is zipping? So zipping is, all right. Okay. Yeah. So zipping is when you are not short of the root canal. In ledge, you're always short of the root canal. But in zipping, you're not short of the root canal, but what you're doing is you are over preparing the apex, right? You are over preparing the apex. You're going right beyond the apical constriction, over preparing the apex, right? And displacing the, basically creating a teardrop shape widened apical foramen. You're not respecting the original size of the apical foramen. You're increasing the size of the apical foramen. All right. Although this is question from endodontics and we are dealing with T&D of dental materials, but since you've asked, I'm asking. I'm telling you. Mansi, you're not getting okay. And yeah, and strip perforation is, see guys, you're talking of a lower molar, mesial root, the distal half is very thin. The dentine is very thin. So if you keep on digging onto the, you know, you're doing inadvertent or over enthusiastic filing of the distal half of the canal of the lower molar in the mesial canal, you end up creating a communication that's strip perforation. More on this on in endo T&D. Mansi, okay, I'll again explain you. Metal, porcelain, right? Porcelain fused to metal crown, first metal, then porcelain, right? The coefficient of thermal expansion of metal is slightly greater than that of porcelain. Number one. Why? Because when it contracts, it will contract more. So metal will contract more. It will tend to pull the porcelain inside, right? But they have solidified. So the porcelain is remaining in a state of residual compression. And this state of residual compression, it's like this. This is my hand. This is the inner surface of the porcelain, and it's like it's pulled inside. So when it stays in a state of residual compression, then during clinical usage or during clinical service, if there is a tendency of crack formation and the crack kind of dilates the surface, it progresses and it wants to crack the surface of porcelain, the residual compressive force will tend to reduce it. Cracking is what? Basically tearing, right? So if you already have stresses which are there inside the inner surface of the porcelain or ceramic, then it would tend to oppose the progression or propagation of crack. I hope that is clear. Right, guys? Great. So wonderful to do this session. I'm very happy you've asked some of very tough questions, and I hope this small session has been beneficial to you. Um, I again reiterate, this is not even a part of the content that we discuss. We discuss things. We take the subject very seriously in DBMCI. We do extensive and very comprehensive discussion of the topics. This was just a very informal kind of you know way of connecting with you guys. Um, this is like just the surface, right? We go very deep into the topics and we try to, you know, uh, do extensive, we don't take shortcuts, simple. So I always say, Bhatia hai to bharosa hai, and I wish you all the very best. It was great connecting with you. Thank you, guys.